ALS can cause changes in your regular eating habits. There may be concerns about your safety and the adequacy of your nutrition. Fortunately, there are modifications you can make that will help you maintain good nutritional status and necessary liquid intake. A number of devices, techniques, and simple changes can make your life much easier and can help you stay well hydrated and nourished. In this video, we'll go over some hints and tips about eating, food consistency, and common symptoms. You'll see people who have successfully adapted to the challenges ALS presents to chewing, swallowing, and maintaining good nutrition. Using the general techniques and suggestions in this video can help you maintain your nutritional status, combat weakness that can come from inadequate nutrition, and improve the quality of your life. Be sure to consult your healthcare provider before trying the suggestions and tips presented in this video, as your care should be personalized to your specific needs. This video is about adjusting to swallowing difficulties, maintaining good nutrition, and learning about a feeding tube. It is designed to be used in conjunction with the ALS Association's Living with ALS Manual No. 5, Adjusting to Swallowing and Speaking Difficulties.
When the patient has muscle wasting disease, good nutrition, of course, and fluid intake is crucial to maintain strength.
The decision-making process in ALS must be moved much forward to a much earlier time. And the recent practice parameter that was published gives guidelines to help people do that.
A part of this disease process affects an area in the nervous system called the bulbar area of nerves. The bulbar area is responsible for the nerves that go to the muscles of the mouth and jaw, the chewing, the tongue, which is one of our very strongest muscles in the body, the muscles that help move the food downward.
Most people take the act of swallowing for granted. While seeming automatic, chewing and swallowing actually involve several groups of muscles. The tongue, jaw, lips, and mouth muscles move the food around in the mouth, while the teeth chew food into small pieces. Food is moved to the back of the mouth and into the throat by the tongue. As the food moves down the throat, the larynx rises and the vocal cords close to prevent the food from going into the trachea or windpipe, which would cause choking and coughing. The muscles of the throat then contract, forcing food down the esophagus and into the stomach. Aspiration can occur when the swallowing muscles weaken and food or fluids enter the larynx and lungs. This can lead to an infection in the lungs called aspiration pneumonia. Weakness of the muscles involved in the process of chewing and swallowing can make eating a challenge. If the amount of food and liquid you can swallow decreases, you are at risk for becoming malnourished and dehydrated. Energy and nutritional needs in ALS, especially in the early stages, are increased. So assuring that you get sufficient calories and good nutrition are vital. Poor nutrition worsens muscle weakness and wasting.
You always hear when you're dieting that many small meals is great because you increase your metabolic rate and then you'll burn more calories. But in effect, you were doing just that. You were increasing your metabolic rate because the disease itself demands a high degree of metabolism, and yet you weren't able to get in enough calories.
Becoming informed about how swallowing problems can affect you is the first step. Next, make adjustments in what you eat and follow other hints and tips provided in this video. Third, plan ahead for the time when you may not be able to take in all necessary nourishment by mouth, and discuss your thoughts and decisions with family members and your healthcare providers. Some early difficulties you may experience include trouble moving food around in your mouth, difficulty swallowing thin liquids and certain foods, or having some food remain in your mouth after you have swallowed.
I was noticing that it was simply harder for me to actually manipulate food around in my mouth.
As the disease progresses, other challenges can include trouble handling your saliva, occasional bouts of choking, weight loss, fatigue, depression, and it may take you longer to eat your meals.
Well, weight loss is a major problem with a lot of ALS patients, and it can be related to two things. One certainly is related to decreased nutritional intake, but also weight loss can be related to muscle atrophy.
We were talking about your weight loss, and you were almost perplexed because you were grazing all the time. You were eating all of the time. You were having food at your desk, food when you traveled, food in your handbag. In fact, you pulled something out of your handbag once to show me. And in spite of this heroic effort that you made, you really couldn't keep up with the weight.
Weight loss is a critical issue, not just for aesthetic reasons, but also because it makes people that don't get an adequate amount of calories or fluids feel bad.
I think one of the points that you need to make to the patients is, in fact, that the disease accelerates if they lose weight.
The reason for weight loss can be very perplexing. Weight loss is so common with patients, and it's not always simply because they have trouble chewing and swallowing. Although definitely because of the problem with chewing and swallowing, it takes more time to eat, more time to prepare the food in your mouth before a swallow. Because of the difficulties with salivation, also people lose weight because it just takes so much energy to eat. People sometimes just get fatigued with eating.
Because you may not be able to adequately swallow the saliva your body produces, it may seem like you have a lot more saliva, and the secretions may be thick if your fluid intake is reduced.
Just at the problems of excess salivation leading to drooling, and figured out that in fact it really probably isn't excess salivation as much as they just can't handle the saliva that they produce.
If you aren't able to eat and drink as much as normal, and the work of eating makes you tired, your muscles will become weaker. This can lead to more fatigue and less energy. These, in turn, can make eating even more of a chore, and the cycle continues to worsen.
The nutritional intake can be affected by many different things, not just difficulty swallowing, which is probably the most common reason. Some patients are depressed. Sometimes appetite is a reason for weight loss, and sometimes we need to prescribe medications that might stimulate their appetite so that they don't lose weight on that basis.
Choking is feared by the patient, but surprisingly, very few, almost ever, never heard the patient died of choking, and I think that's my experience.
Although patients choke frequently and they're terrified of choking to death, that the choking is usually self-limited, and it's usually started by a little saliva or a little bit of food, and it is very frightening to the patient, very frightening to the family, and yet seldom is that really indicative of breathing problems.
Did you choke? I have. Rarely. It has happened, but not much. And maybe 2 or 3 times still, just, and of course that's 2 or 3 times too many. It's scary.
Many patients can still swallow, but they're very, very fearful of choking, and therefore they avoid eating a lot of food.
Meals simply began to take a little bit longer, and it was a small enough difference initially that I didn't even notice, but 20 minutes became 25, 25 became 35, and
to complete the usual
to complete the usual meal. And so eventually I realized that my kids at the table would finish and then, kind of wait and then excuse themselves. Eventually I realized that everyone was finishing before me, and then that was when I realized actually our whole kind of routine then began to change as we ate.
Constipation can occur in ALS for a variety of reasons. Abdominal muscle weakness, immobility, changes in the diet, and inadequate fluid intake can all contribute. Being as physically active as possible, assuring that you stay well hydrated, and consuming high sources of fiber can help prevent and control constipation. Contact your nurse or doctor if this becomes a chronic problem, or it's been 3 days since your last bowel movement. There are a number of things you can do to maintain good nutrition despite difficulty with chewing and swallowing. As with so many of the issues and decisions you may face, a team of healthcare professionals knowledgeable and experienced in ALS can help you manage the swallowing and weight loss symptoms of this disease. A swallowing expert, dietitian, nurse, and physician can all help you maintain good nutrition.
There are many reasons for patients to be cared for in a multidisciplinary clinic. Patients need care from multiple healthcare personnel. And I think one of the most expeditious ways and efficient ways of caring for them is for them to go to a multidisciplinary clinic so that they could see, for example, a pulmonologist or a dietitian or a speech and language pathologist.
The need for nutritional assistance are things that are often only recognized when the horse is out of the barn, when the situation has deteriorated to such a degree that we're in a crisis.
Good nutrition will give you more energy and a better sense of well-being. A well-balanced diet is essential for maintaining body muscle and fat. Without enough food, your body will break down its own muscle and fat, leading to weight loss and further muscle weakness.
Interventions to increase weight as just a doctor issue, but it's a quality of life issue. And so we try very vigorously to ensure that all our patients are getting enough hydration and enough calories.
Increasing the number of calories you eat through carbohydrates and fats will help you maintain your weight and good nutrition. Select foods such as pasta, ice cream, puddings, eggs, potatoes, cheese, cooked vegetables, soft fruits, breads, cereals, and add butter, mayonnaise, sauces, and jelly to foods. Generally, there is not a need to add extra protein to your diet. It's a good idea to choose liquids that are thick, milkshakes instead of water, cream soups instead of broths.
Thin liquids are difficult for ALS patients to swallow. We recommend a product called Thicket or something along that line. It actually is a powder that's added to any liquid and thickens it a little bit so that the patient can create the bolus and comfortably move it down the food tube and into the stomach.
For many people with ALS, there is an increased need for calories. Your diet should include adequate calories, carbohydrates, fats, proteins, vitamins, and minerals. Consult with your physician, a dietitian, or nutritionist experienced in the care of people with ALS for a specific nutritional plan to meet your individual needs and to address additional medical problems you may have. Changing the consistency of the foods you eat can make a big difference in how easily you can chew and swallow. Generally, problems with chewing and swallowing occur gradually, so small changes are effective in helping you eat and maintain nutrition.
Modify the consistency of what they eat. So rather than trying to eat lettuce and rice and peanuts and things that do have a tendency to get stuck in your throat, to try to eat softer foods. Any type of food with a gravy, for example, soft chicken or hamburger meat with a gravy is a lot more easy to swallow than a steak.
I would say that I definitely focused or concentrated more on being sure that I chewed my food really well.
Soft, moist food is less tiring to chew and will slide down your throat more easily. You may want to avoid foods that are hard to chew and swallow. Using a blender or food processor can help you enjoy the foods you like but have a hard time eating.
For patients who are having difficulty directing that food to go right down into the stomach and not get into the lungs, we would recommend a chin tuck swallowing technique where the patient takes their food serving size and tucks their chin and swallows slowly and carefully, and the food is more likely to comfortably and safely pass down to the stomach.
If you have too much saliva or it is thick, there are some tips that can help. Swallow frequently but slowly and carefully. Avoid very sweet and sour foods that can stimulate saliva production. Increase the amount of fluids you drink. If you think that milk products are thickening your saliva, try soy substitutes for dairy products. Avoid chocolate if it makes your saliva thick.
Some foods, especially dairy products, set up kind of an uncomfortable, mucousy feeling in my mouth that I don't like, although I put up with that for ice cream.
Well, of course.
It may help to eat several small meals a day rather than trying to eat 3 larger meals. If energy levels and fatigue are issues for you, select foods and beverages that are easiest to chew and swallow, and choose high-calorie foods with a lot of nutritional value so you are getting as much as you can for the energy you are expending in eating. Taking a nap before meals and substituting a nutritional supplement for part of your meal can conserve energy.
Then there's also nutritional supplements, Ensure Plus, that patients can still swallow, mix with ice cream, and have a shake that can also add calories.
Commercial nutritional supplements are high in calories, protein, and various vitamins and minerals. They are convenient but can be costly. Some are available in beverage and pudding forms. Examples include Ensure, Boost, Jevity, and Carnation Instant Breakfast. They can be found in drug, discount, and grocery stores. Whether you are eating all of your food by mouth or taking some of it through a feeding tube, nutritional supplements are a convenient way to get concentrated nourishment. If supplements are your only source of nutrition, some insurance plans will cover the costs. Many people ask about vitamins and other types of nutritional products. At this time, there is not clear scientific evidence that additional vitamins or supplements, other than those just mentioned as food replacements, can benefit people with ALS. However, a number of people with ALS do choose to supplement their diet with vitamins and other products. Be sure to check with your healthcare provider before taking any new vitamin, mineral, or other nutritional product. Sometimes people have weakness in their hands and arms that makes it hard to feed themselves. Even without problems with chewing or swallowing, these people can experience weight loss and nutritional problems if they are alone without help to eat. Tips to combat this problem include having food and beverages left ready to eat easily, with containers open, straws in place, and food set out if possible. Mechanical devices can be helpful as well.
Some patients, for example, have good swallowing abilities, but their arms have become very weak, and it's difficult for them to lift a fork or a spoon to their mouth, in which case we have devices such as ball-bearing feeding orthoses that can assist patients in trying to feed themselves.
The social aspects of eating are important. While this video addresses how to maintain good nutrition when chewing and swallowing are problems, the conversations and closeness that are a part of a meal shared among family or friends need to be addressed too.
Mealtime is a social time, and I think it's important for patients to feel like they can sit down with their family and eat meals together and not take that away from patients and families. That time is very, very precious.
Planning ahead to have foods that are the easiest for you to swallow and eating some of your food before the meal can help you have the time and energy to be a part of the social aspect of eating.
I didn't look forward to eating out socially as much because of that issue of length of time, that when you go out for a meal, you know, that is a social event. I knew that when I went out to eat that I kind of had to make a choice. He's either going to be a listener and be an eater, or don't eat very much and be able to participate socially.
Right.
Sometimes find myself eating a small meal at home first so that I wouldn't be as hungry. I could go and eat and maybe just have some soup or some food that was much easier to deal with. And then be able to participate in that social part of the meal.
I see. Great.
Letting people know early enough, in advance of junctions in the road that are imposed by advancing disease, educating people about their choices. The practice parameter is really fashioned to help people at branch points in decision-making to be able to make the right decision, the best informed decision based on evidence that will help them to manage the disease most effectively.
Despite your best efforts, at some point you may find that you are not able to eat and drink enough to maintain a good nutritional status. An alternate method for you to consider is a feeding tube, also known as a PEG or percutaneous endoscopic gastrostomy tube. Receiving your nutrition through a PEG tube can stop weight loss and dehydration and help you have more energy. In addition, the risk of choking is reduced. Although it is not considered an extraordinary medical measure, any surgical procedure such as a PEG carries certain risks. Ask your doctor about the risks and benefits of having a PEG tube and the alternatives.
When a person begins to have swallowing difficulty and when weight loss begins to approach 10% of body weight, or when a person is beginning to fatigue or have any choking with swallowing, it's time. It isn't time to put it off. It's time to make a decision now about having a PEG. We know that early decision-making enhances quality of life and reduces risk. If we wait on PEG until a person has lost a lot of weight and their choking and their respiratory function declined, the risk is much higher.
Choosing not to have a PEG tube may make it increasingly hard for you to deal with the symptoms discussed in this video. Problems with chewing and swallowing foods, liquids and medications, weight loss, choking spells, fatigue, and constipation will continue. Family members often become increasingly distressed as these symptoms continue to worsen. Having a feeding tube placed can have a very positive impact on your family caregiver, who will feel relief that your nutrition and hydration needs are safely met.
When we see that a patient is losing weight despite these kind of simple dietary modifications and nutritional supplements taken orally, that's when we start to discuss the option of a feeding tube.
Continued nutrition, let's say percutaneous endoscopic gastroscopy, we call PEG, which is very practical, neat, and convenient and clean method, and very effective. And that's what I use these words to the patient.
Sometimes patients really don't want to give up that autonomy. They say, I'm really not interested in having that PEG placed. I don't want to stop eating.
I also like to stress the fact that they'll still be able to eat by mouth and that the tube is there for additional hydration, for medications, and just for supplementation. But what I find really makes people want a tube is when they go to a support group and they meet someone who has a tube. That personal testimony, looking at the tube, feeling it, touching it, saying, is your life easier? That makes a much more convincing argument than anything that the physician can say.
There are steps to follow in the process of making a decision about whether or not you will have a PEG tube inserted. First, become well informed. Get authoritative and full information about the pros, cons, and costs, what's involved in the procedure, how the tube feedings work, and what care is required. Don't try to get all of the information you need at once. It can be overwhelming. Identify the information you need and gather it over a period of time. It is best to begin thinking about this and other decisions in dealing with ALS early in the course of the disease. By planning ahead, you will have time to become educated and to discuss your concerns and ideas with others over a period of time. You will be better prepared than if you wait to make decisions when your medical condition is at a crisis stage. Talking with people with ALS who have chosen to have a PEG and those who have chosen not to have a PEG can be very helpful.
Some people say, I want to know, everything up front, and essentially be honest about all the hard stuff with themselves and their spouses, their kids, and others kind of don't want to think about it. I do find there's a difference there, and when you talk to people about the feeding tube issue, especially before it's something that the disease forces them to make a decision about. Some people want to think about it and deal with it up front and ahead of time. And some would just prefer to not
Ignore
have
it and hope it goes away.
That's right, and that's not a camp I'm in.
Yeah.
Talk over your questions, ideas, thoughts, and concerns with your healthcare provider and your family. While the decision is ultimately yours to make, other people in your life will have points of view and information that will be important for you to consider. As with other choices you face with ALS, the decision about a PEG tube is a highly personal choice. Your personal values and any cultural considerations will certainly influence this decision. While the nutritional and energy benefits of having a PEG are clear, and there is evidence of an increased survival, you will want to carefully consider a number of issues in making your decision. Regardless of the decision you make, your ALS healthcare providers will work with you throughout the course of your disease, providing all the care and support they can offer.
Last summer, we spent 2 months in Europe, and she lost a tremendous amount of weight. And as soon as we got back here to the States, went to the doctor, and they felt that this is the only way to help her, because she could take nothing by mouth. If she did, she choked.
The option of a feeding tube sounds like a very scary option to a lot of patients, because I don't think they understand what our purpose is in placing the tube. It's certainly not to substitute their ability to swallow and enjoy food. I never tell a patient that they can't eat once the feeding tube is placed, but it's just a mechanism to supplement their diet and their nutrition and their hydration by a means that is a very simple thing to do. We usually recommend the feeding tube if we start to see that the patient is having early swallowing difficulties, if there's weight loss that we can't control with oral supplements, if it just becomes too fatiguing or tiring for the patient to eat or swallow. Those are certainly times that we encourage putting it in.
I thought maybe that I would be aware of it more, or I could feel it moving or hanging or something like that, but I am honestly totally unaware of its presence during the normal course of my day.
There is evidence that when people are having so much difficulty swallowing, that fatigue is a big issue, that they're really starting to lose substantial weight, and that the eating process is becoming a labor, their quality of life can be improved and their survival can be substantially lengthened by the evidence that we have.
Other things to think about in making your decision are what outcomes and goals are important to you in living with ALS. Quality of life is different for each person. What is important in your life, and how does a decision about a PEG tube relate to what's important to you? Be willing to revisit your decision about PEG over time and openly discuss your preferences and concerns with your family members and caregivers. It's perfectly normal to change your mind, maybe several times. Decision-making around major issues is best when it's a process and not just a single decision event.
Talk with people with the assumption that people may change their minds, so that revisiting important issues at least every 6 months or so.
Be sure to get information from trusted sources on the risks, benefits, and consequences of your choices. Ultimately, you want to be satisfied with the choices you make about your care and any medical interventions.
Since my PEG tube, my weight's gone back up.
It effectively helped her because she gained some weight, and at the present time, with the amount of longevity that she is getting, which is 6 cans a day, she has maintained her weight pretty steadily.
I don't feel that it's even noticeable that it's there. I don't think people can tell.
People who have reduced breathing capacity are at a higher risk of complications from the surgical procedure to insert a PEG tube. For this reason, you'll want to be aware of both your nutritional and breathing status when considering a PEG tube. The procedure may require that you lie down, and a mild sedative is generally provided.
We monitor patients' breathing capacities, and we've certainly encouraged patients to do it before their breathing drops below 50% of what would be normal for their age and height. Putting feeding tubes in when the breathing capacity is lower than that can cause some potential complications, so we encourage them to do it early.
But the important thing is the forced vital capacity or for vital capacity should be above 50% of predicted. And the reason is a patient has to lie down for procedures. Minor sedatives should be used to put simple gastroscopy, and that sometimes create trouble postoperatively. And that's the reason we recommend strongly if PEG is placed, vital capacity should be certain level.
It's really a very safe procedure if it's done early.
A PEG tube is inserted into the stomach through a small incision in your abdomen. The tube is guided by an endoscope that goes through your mouth and into the stomach briefly and then is removed. The tube itself is soft and pliable and extends outside of the stomach about 6 inches, or is flush with the skin in a button form. New techniques for placing feeding tubes are being researched that may provide future options other than a PEG placement. Some of these alternatives could make it safer to place a feeding tube when your breathing capacity has weakened.
This is called a button peg, or a low-profile gastrostomy is the doctor term for it. And it basically alleviates the need of having a tube actually hanging out of the abdominal wall. This basically is placed in the hole in the abdomen and goes directly, this is the portion of the tube that goes into the stomach, and there's a balloon here that will be filled with water to hold the tubing in place. And then what the family or patient does is simply open this up like a little Tupperware top and insert the tube into this hole, and then pour whatever supplement or medications or whatever through the tubing. When the feeding is done, they just disconnect the tube and then close this back up, so that the only thing on the surface of the stomach is this little button, which is very easy to take care of. You just wipe it off with some hydrogen peroxide twice a day, and it's really very unobtrusive. And this is wonderful for patients who may not necessarily have significant swallowing difficulties, but their breathing capacity suggests that we should go ahead and put the tube in early. And so this can just sit on the abdomen for as long as it takes before patients need to use it.
You may be at the hospital just overnight or for a day or two. A dietitian, nurse, or your doctor will let you know how much food, nutritional supplements, and water you will need each day. It is usual to begin the new feeding slowly, increasing amounts over several days.
The tube, when it was put in, was not painful. As a matter of fact, the time that she was in the operating room with the doctor was probably about 20 minutes. And she stayed in the hospital for 2 or 3 days so that they could get the tube regulated and regulate her feedings. And after that, it was no problem.
Specific care of the PEG tube and the incision site varies depending on the preferences and experiences of different healthcare providers. However, the care is straightforward and easily accomplished with a minimum of instruction. Keeping the entire area clean and dry are important. A loose gauze bandage around the tube at the incision site is standard for the tubes that extend several inches. Being alert for signs of infection, such as a pus drainage or fever, is important.
The peg is not painful at all. I've had the tube in now for 2.5 months, and the portal, the stoma, seems to be very well healed now, but sometimes it does get irritated a little bit, so there's maybe a little bit of mild discomfort if it's a little bit irritated, but other than that, it's not uncomfortable at all. I forget I have it.
How do you take a bath or a shower with a peg?
Other than just removing that gauze backing around the portal site, there's no issue at all around bathing or that sort of thing. Not at all.
The biggest problem that comes in is keeping the opening clean, and we handle it that way with the soap and water, and we use bacitracin, and that keeps it clean, and of course we keep it covered, and so that part works. We have to undo the tube, which is inside her clothes, and so we will just undo the tube. Before I did this, I washed my hands, and everything is clean, and I've prepared the container, and I have a can of Jevity, which I will put in. Each feeding, she has 4 feedings a day, and it's 1.5 cans per feeding. And so now I pinch off the tube and I insert the syringe. Many times we get back a little bit of a burp, but that's normal. And I just take the water and I will flush the tube with an amount of water. And once the water has gone through, I will feed the Jevity to her. It's a gravity-fed feeding that we do. In case of an emergency, I will take the plunger, and if there's a blockage or anything, I can use the plunger to unblock what happens.
If fluids don't easily flow into the PEG tube and you think that it may be blocked, you or your caregiver can use the large plunger to apply gentle pressure to clear a blocked tube. You should not use more than a mild to moderate force to clear the tube. Using water to flush the tube before and after each feeding and all medications will keep the tube clear. Contact your healthcare provider if you think that the tube is blocked and you are unable to clear it.
I do feed the medications that she has, and she does have quite a few, crushed, and then I just insert and put it into the tube, and it goes through that way.
In terms of how much feeding to do, this is also something that we, in consulting with different nutritionists, found out that an Ensure Plus can has 375 calories, and his weight and his height, and then they determine how many cans of Ensure Plus he should have in a 24-hour period. This is something that a doctor has to determine for a patient. You just don't put the peg, send the patient home, and not give the patient a clue of what to do. And there is a gauze that is especially designed for the use of a peg. It has this slit, which again is something that we didn't know, and we were buying our gauzes and cutting them through with scissors. When I learned that this was available in the market and we don't have to cut, and we use a minimal amount of Bactroban with the sterile Q-tip and just dab the area after every shower and keep it clean, and again, the infections don't happen. The area we learned with the course of time is red, and that is the normal course and the normal result of this surgery and this procedure, and there is nothing to be alarmed about, nothing to run to doctors about, because this is the normal state.
Very mobile, easy to handle, and in most cases doesn't need anybody else to help her.
Take care to keep the feeding tube from coming out. If the PEG tube does fall out, it is not a life-threatening emergency, but you should seek immediate medical attention to have the tube replaced.
If this comes undone, do not panic. Patient doesn't die. It will bleed. Do not panic.
Your healthcare team will provide specific instructions and written information for you and your family about your tube feedings and the care of the tube and incision site. Once you are at home, contact them for any concerns and questions that may arise. Maintaining good oral hygiene and getting routine dental care are particularly important when you have trouble chewing and swallowing, and they can reduce the risk of respiratory infections.
So we have to do a lot of oral hygiene. So I've gotten her a water pick, and she syringes her teeth in her mouth every day in order to keep, more than once a day, twice a day. And so that keeps her oral hygiene going straight that way.
One of the bigger issues for me about having a tube was that I was concerned about my sex life. Mm-hmm. I'd say certainly that's something that is a really important issue for people who are concerned having a PEG to talk about that. And simply talk about that issue. Yeah. I was afraid to bring it up, and when I finally did, then of course my wife, who is a wonderful partner, really put me at ease about that. I would have worried a lot more about it had we not talked.
Although ALS presents a challenge to maintaining good nutrition, you can overcome these challenges. By planning ahead and making adjustments, you can control weight loss and the weakness that comes from malnutrition. And as you have seen in this video, many people living with a PEG tube have chosen to make it a part of their life, not their whole life.
There are many things that you can do to help have control, maintain control of this disease and stay ahead of the curve.
Since March of this year, my wife hasn't had the ability to ingest food, and we've had to go to gravity flow bags after the insertion of a tube by operation. We have tried as a family not to let this hinder us in the ability to do some normal things, see people, and go places. We had the opportunity on National Awareness Day for ALS, to be in Washington to meet with various congressmen and senators. And everybody else had the opportunity to have lunch and eat. And my wife's occasion was only to find a place where we could set up the gravity flow bag. We did that in Senator Lautenberg's conference room by making use of his library and his large books. And we hung the bag to his books and continued on with the activities.
The main thoughts for me have to do with, do I really want to fight this illness? How proactive do I want to be to stay stronger, longer? And I initially felt that having a peg tube would be sort of giving in to ALS. It would be accepting a next inevitable, in a sense, backward step in the progression of an illness. But it was a fairly sudden jump in perception from this is not giving in or accepting. In fact, this is the opposite. This is taking charge and doing something very positive that allows me to stay hydrated and have the best nutrition and stay the healthiest that I can.
The ALS Association has a number of free educational materials on nutrition and PEG tubes. Just contact us for more information and help in adjusting to swallowing problems. You are not alone in your fight against ALS. The ALS Association thanks the people with ALS, their families, and healthcare providers who provided the inspiration for this video and who welcomed us into their homes and their lives. This video and others in ALSA's Living with ALS series is provided without charge thanks to the generosity of our individual donors.